Dr. Thompson, how would we know that someone that was with us was having a stroke? What would we look for?
Very good question. Hard to answer that.
Not as obvious as a heart attack, right?
No, frequently not. Heart attacks can be masked, but strokes, and particularly pre-strokes, or what we call transient ischemic attacks, can happen to someone with us, and we need to try to encourage that person to take some action. We've talked in other segments that if an individual loses their ability to speak, if they suddenly have an unexplained weakness in a certain part of their body, if they have trouble with their vision, if they become even subtly confused for a few seconds or half a minute or a minute or two, have slurred speech, they may not be aware that their speech is slurred or that they're having this. Some people, when they're having these neurologic symptoms, seem to be cognitively somewhat unaware of it.
Really?
So another individual, I've had many people bring a family member in and say, you know, we were talking, and he or she talked in garbled speech for a couple minutes, and then they seem to be fine. And then the problem is that, you know, Uncle Harry or Aunt Gladys or whoever you're with, they say, "Oh, I'm fine. I don't think I did that. I don't want to do anything." And so now kind of it's an arm wrestling match, you know. But you need to encourage those people and be demanding if necessary to get them in and get them checked. So if you're with someone who becomes confused, and if they stay confused, they may not be cognitively able to understand you when you talk with them, to follow your directions. Well, you may have to literally lead them out and call 911 and get them in somewhere. Or if those symptoms are transient and go away, they may not remember them, and then they may be resistive to going in and getting checked out. You need to be adamant and really push them to go. And right, very firm. And the reason is because the sooner they can be evaluated, if they have had a stroke or are having a stroke, there are certain high-tech emergency procedures and steps that can be followed that literally may prevent or reverse the stroke so that they don't have permanent damage from it, and they'll live to thank you for it later.
When they can talk straight.
When they can talk straight, that's right.
Thank you, Dr. Thompson.
You bet.